Arthritis signals people in a variety of ways. Joints might crack when you suddenly stand up or move. Other joints may be stiff and creak. Maybe pain occurs when you're trying to open a jar or type on your keyboard. Arthritis means joint inflammation and has over 100 related conditions or types of disease. Untreated, it can advance, resulting in joint damage that is difficult to undo or reverse. So early detection and treatment are important. The two most common types of arthritis are osteoarthritis (OA) and rheumatoid arthritis (RA). Although both have similar symptoms, both happen for different reasons. When joints are overused and misused, this results in OA. What happens is the cushioning cartilage that protects the joints breaks down, resulting in bones rubbing together. This generally happens in the knees, but can be found in the hips, spine and hands. In RA, the body's immune system attacks joint tissue. Still not fully understood by doctors, this condition often starts in a person's hands, wrists and feet. Then it advances to shoulders, elbows and hips. Similar symptoms include pain, stiffness, fatigue, weakness, slight fever and inflamed tissue lumps under the skin. And both OA and RA generally develop symmetrically, i.e. affecting the same joints on both the left and right sides of the body. A difference in OA and RA is in the way you swell. With RA, people report soft and squishy swelling, while with OA, people report hard and bony swelling. Another difference is you are likely to develop RA if a sibling or parent had it. If you have a history of joint damage, either an injury or chronic strain, you run a higher risk for developing OA. There is no specific age for arthritis sufferers. While it can affect every age group, it seems to occur more frequently on those over 45 years. And while neither gender is immune, a reported 74% of OA cases and a slightly lower percentage of RA cases occur with women. People with excess weight tend to develop OA, especially in the knees when reaching over 45 years. However, losing weight can turn the odds around almost by half. Regular activity combined with exercise also reduces risk of OA. Although there are no cure-alls for arthritis, there are a variety of pain relief treatment strategies. Aside from medications, remedies, replacement alternatives and other helpful treatment options and alternatives, the 5 main arthritis relief aids are gentle exercise, good nutrition, special herbal and other nutrients, a positive attitude and rest. Today, only a small percentage of those afflicted with arthritis become crippled. And most never need canes, wheelchairs, or other ambulatory devices. If you suspect you may have arthritis, it is advisable to seek medical advice from your doctor or alternative practitioner. Look to reduce pain and inflammation using natural remedies before you decide on using doctor-prescribed drugs. 10 easy tips for arthritis pain relief. Think you can't stop that arthritis pain? Great news! You can act now. Get 10 super easy and effective arthritis pain relief tips from arthritis experts and make your life with arthritis a little easier now. Protect your joints. Don't keep your joints in the same position for a prolonged period of time. Balance your rest and work throughout the day. Use the strongest joints available for the job. Stretch it. Stretching should be part of every arthritis patient's daily routine. A good stretch helps prevent injuries by warming up muscles and tendons which are more limber and less likely to tear. Spend at least 10 minutes each day stretching, and work each major muscle group. Cool it down. Stop physical activity. Rest in a cool, shaded environment. Spray with a mist of cool water or wrap an ice pack or cold compress in a towel and apply it to reduce arthritis pain and swelling. Get moving. Exercise can help reduce joint pain and stiffness and increases flexibility and muscle strength. It can also help with weight control, stress management, and make you feel better overall. The Arthritis Foundation also offers water exercise and other classes. Get a massage. Massage therapy can relieve your pain, soothe stiff sore muscles, reduce inflammation and swelling. Make sure you use oil or cream on your fingers to make it more gentle. Work the area for 5 to 10 minutes a day if possible. Keep your weight in balance. Being overweight, even just moderately, impacts weight-bearing joints and can increase the pain of arthritis. Studies have indicated that losing extra weight lowers the risk for developing osteoarthritis of the knee. Losing weight can help slow the progression of arthritis too. Get a diagnosis. If you are experiencing symptoms like pain, stiffness, swelling for more than 1 week, you should consider seeing your doctor and getting a diagnosis. Remember that there are more than 100 types of arthritis. It is important to get the specific diagnosis for the type of arthritis you have. Take your medication the right way. Don't stop taking your medication just because you feel it is not working. Check with your doctor first. You need to understand that it may take several days to several months for a medication to become effective. Look out for new options. Recently, FDA has approved some new drugs for osteoarthritis, rheumatoid arthritis and other arthritis diseases. If feel that the current medication doesn't work well, check with your doctor about possible new options. Keep educating yourself. It is important to learn something new about arthritis. Find some good websites online and subscribe to their newsletter if they have it. Join one of 2 active online arthritis communities like forums or bulletin board. Never hesitate to see your doctors and ask questions. Herbal remedies for arthritis, fibromyalgia, spondylosis, muscular ache. Arthritis is one of the most common chronic diseases in the world. According to Ayurveda, arthritis is primarily a vata air disease which is due to accumulation of toxins in the joints and is known as amavata. This can be caused by poor digestion and a weakened colon, resulting in the accumulation of undigested food and the buildup of waste matter. Poor digestion allows toxins to accumulate in the body, and problems with the colon allow the toxins to reach the joints. Symptoms: fever, immense pain and stiffness in affected muscles in case of chronic muscular rheumatism, pain or tenderness in a joint which is aggravated by any movement or activity, such as walking, getting up from a chair, writing, typing, holding an object, throwing a ball, turning a key, excruciating pain and stiffness in the joints in case of chronic articular rheumatism. Home remedies: the following are a few simple cures that might just help relieve you from the pain of arthritis. Try any of them to see what works for you. 2 teaspoons of lemon juice and a teaspoon of honey mixed in a cup of warm water taken twice a day is good for curing arthritis. 2 teaspoons of juice from fresh leaves of bathwa. Drink every day on an empty stomach for 2 to 3 months. Half a teaspoon of turmeric powder with warm water helps cure arthritis. Taking alfalfa tea twice a day makes a good cure. 2 teaspoons of apple cider vinegar and 2 teaspoons of honey dissolved in a small glass of warm water taken once or twice a day brings relief. Rub the aching joints with hot vinegar to get some relief from pain. 2 parts pure olive oil and 1 part kerosene makes a wonderful liniment to bathe afflicted joints. Add 1 tablespoon cod liver oil to the juice of 1 orange, whip and drink before sleeping. 1 raw clove of garlic every day is very beneficial. This clove can be fried in ghee, clarified butter, or castor oil. Take for 2 months. Gugulu is very helpful in curing arthritis. Eat half a teaspoon twice a day after meals with warm water. Exercise the afflicted joints in a tub full of hot water. Drink carrot juice, cucumber juice, eat cooked vegetables and/or vegetable soups, and drink coconut water for a healthy body and massage your joints daily to cure arthritis. On an empty stomach, eat 2 to 3 walnuts or some coconut. Avoid mental tensions that lead to stress. Lose weight, if necessary, to get close to your ideal weight. If you weigh less, there is less weight on your joints and less pain. Effective and proven results for Arthcare oil, anti-inflammatory and muscle relaxant herbal massage oil. Arthcare oil is the best natural solution for your problem, manufactured under the guidance of renowned MD Ayurveda specialist Dr. Arthcare is an anti-arthritic herbal oil which not only gives a sure relief in rheumatic arthritis but also strengthens the bone tissues, the skeletal and the neuromuscular systems, giving a comfortable movements of joints and muscles. It is a powerful antioxidant and increases the energy level. Arthcare penetrates the body tissue faster than any other ointment because of its strong anti-inflammatory action. It removes stiffness and improves mobility of limbs. It brings relief from backaches, muscular strains, rheumatic pains, joint pains etc. Body massage with Arthcare oil relaxes an asthmatic person. Arthcare is scientifically proven Ayurvedic formulation containing the herbal combination of well-known traditional herbs described above. Within few minutes of application you will feel relaxed from pain. For best results, take 2 Arthcare capsules twice a day and massage the affected area with Arthcare oil 2 to 3 times a day. Herbal remedies. The use of herbs is a time-honored approach to strengthening the body and treating disease. The following have been used traditionally to treat rheumatoid arthritis. Shellaki, also known as Boswellia serrata, comes from a tree that yields gum when its bark is peeled away. In clinical trials, promising results were observed in patients with rheumatoid arthritis, chronic colitis, Crohn's disease. Researchers found that standardized Boswellia extract significantly reduced swelling and pain and usually reduced morning stiffness for people with rheumatoid arthritis. Ashwagandha, Withania somniferum, is an Asian plant of the potato family. Its roots have long been used to treat rheumatism, high blood pressure, immune dysfunctions, erection problems and also to ease inflammation. Because of all this, it's sometimes called the Indian ginseng. Ginger, Zingiber officinale, may be among the best studied of the 4. Research suggests ginger root inhibits production of prostaglandins and leukotrienes, which are involved in pain and inflammation. In an uncontrolled 1992 Danish study, 56 patients who had either raw, OA or muscular discomfort took powdered ginger. All of those with musculoskeletal pain and 3/4 of those with OA or raw reported varying degrees of pain relief and no side effects, even among those who took the ginger for more than 2 years. Herbal oils are applied to the arthritis to loosen stiff joints, restore mobility, remove pain, inflammation or swelling, nourish tissues and relieve pain. The experienced hands dipped in the pleasantly warmed oil will travel all over the body with pressure. Arthcare not only increases blood circulation but also gives a sure relief for rheumatic arthritis, spondylosis, paralysis, muscular disorder, slipped disc, asthma and tuberculosis. Brings in relief from stress, strain and tensions. It is also very good for toning of one's muscles and nerves. Get instant relief within minutes of application of oil. Advice. Epsom salt, magnesium sulfate. Magnesium has both anti-inflammatory and anti-arthritic properties and it can be absorbed through the skin. Magnesium is one of the most important of the essential minerals in the body, and it is commonly deficient in the American diet. A New England remedy for arthritis is a hot bath of Epsom salts. The heat of the bath can increase circulation and reduce the swelling of arthritis. Dosage and directions: fill a bathtub with water as hot as you can stand. Add 2 cups of Epsom salts. Bathe for 30 minutes, adding hot water as necessary to keep the temperature warm. Do this daily as often as you'd like. Thank you for watching. Please don't forget to like and subscribe to my channel and please click on the bell so you'll be updated on my next video. Thank you. WeCare for UPH, your health comes first.